viewers, and welcome to another live with MHT. I'm Anthea Pinto, and today we are talking about medication for mental illness. So, I think with a lot of people in our society, medication for mental illness is seen as something very taboo. People have a lot of misconceptions about it because it's something that's not talked enough about. But we are here to change that. So, joining us today is an experienced psychiatrist and psychotherapist based in Mumbai, Dr. Jyoti Maheswari. Thank you so much for joining us today, Dr. Jyoti.
Thank you for invitation. My pleasure, Anthea. Nice to be here on this platform.
Yes, it's so amazing to get to talk to you about this today. So, starting off with, why don't you tell us some of the common mental disorders or mental health issues that people suffer from today?
Yeah. So commonly, like I always talk about, generally, whenever we talk about mental illnesses, I talk about mental disturbance, mental disorder, and mental diseases. Okay. Mental disturbance is what we see generally day to day. Something goes wrong and you feel upset, you feel hurt, you feel sad. Mental disorder are little more into symptoms like anxiety disorder, personality disorder.
Mm-hmm.
Then there are mental diseases where it's a depression, major depression. And there is a schizophrenia, bipolar disorder, OCD, panic attacks, and so on and so forth. There are list goes on. But commonly, what we see is anxiety, depression, schizophrenia, mania. These are
Mm-hmm.
the commonly seen issues in mental
Okay.
illness.
So, as these are most common today, why don't we talk about the medications that are commonly prescribed for these issues and how they work?
Yeah. So, see, before talking about the medications, I would like to just mention why these mental illnesses occur. So that makes it a little easier to understand. Once you
Yes.
know what is the cause, we know how the solution is going to work. So mental illnesses is basically happens because there is some imbalance into the what we say is serotonin and dopamine, all kind of hormones which are there, okay, in
Yeah.
our brain. And why that imbalance, we really don't know. There is genetic predisposition definitely which is there.
Mhm.
So there's some echo I'm hearing.
It's fine on my end.
Okay, yeah. Um, so there is, as I was telling you, there is some neurotransmitter balance which is there and which can be due to the genetic predisposition. So what happens with the medications? This imbalance is corrected.
Mhm.
And obviously something which is there in the brain, we cannot correct it just by talking. And that's the need for the medication. So this medication helps in bringing that level back to the normal. Whether it's a serotonin, whether it's a noradrenaline, whether it's a dopamine, whatever may be the this neurotransmitter which is imbalanced. So this can be corrected with the medication. And now talking about like whatever the illness which is there,
Mhm.
accordingly the what you say the treatment will be prescribed. Like for depression, there are antidepressants. For anxiety, there are anxiolytic medications. Common being alprazolam. I'm not going to say any brand name or something. Yeah.
Mhm.
For the schizophrenia, we have antipsychotics.
Yes. So, for each of these medications, can you tell us, like, maybe in very simplistic terms, what exactly it does? Like, for example, what would an antidepressant do?
Yeah. So antidepressants will help the person to come out of depression. Now, what do we mean by come out of depression? So for
Mm-hmm.
that, it's very important to understand what exactly happens into the depression. Right?
Yeah.
Depression, there is a problem with your sleep. Okay, that is the first and foremost. Either person is less or sleeping more. There is a problem with appetite. Person is not able to, eat well. Okay,
Mm-hmm.
person feels sad most of the time. Right? there is a lot of what you say, guilt feeling sometimes. Sometimes there are suicidal ideation, person feel very fatigued, tired, loss of interest. All these are the symptoms. So when the person is started on the antidepressants, then person starts feeling better on the account of sleep is improved, appetite is improved, the mood changes from sadness to feeling normal. Okay? The interest comes back into all the activities. Many times people feel withdrawn. They don't want to mix with the people around. They want to be in their own bubble. They don't want to face the world. And that is why it also affects on their work, be it student or housewives or working people. They're not able to do that. So all these changes which happens into the depression, they are corrected by antidepressants when we started.
Okay, so a common question that people have before taking these medicines, because I know even when early in this year I was diagnosed with depression, and when the doctor prescribed me that antidepressant, I was very apprehensive about it because I felt that what if this medicine it's going to affect my brain? What if it changes my personality? So is that possible? Can an antidepressant, for example, change who you are?
A nice question. Very common misconception what people have. See, there are two different issues. One is the personality problem, okay, and one is the illness per se. So personality is going to remain what you are. It's not going to get affected unless and until you have a personality disorder. That is separate. Maybe we'll be talking about it in the course of our conversation. But illness per se is a different. So definitely when you're treating the illness, it's not going to affect your personality because we are just focusing onto the illness part. And as I said, when it's illness, it's only that physical. So that we correct it. It's not going to affect the personality. See, whatever the changes we see when person is in depression,
Mm-hmm.
those are the temporary changes. But if by nature person is a social, that's a personality. Okay? So it's going to remain same. It's not going to get affected. Rather, because of depression, person may not like to socialize, which will be corrected with the antidepressants.
Okay. So um, let's talk about the process for someone who is taking. Okay, let's start with antidepressants. So the first experience, I think, like, because you're suddenly taking something that can um, affect your hormone levels and change your mood. So that instant feeling can be something very different from what you're currently going through. So I remember the first time, like the very first day I took that antidepressant, I felt this, I felt happy, I felt light, but there was a thought at the back of my mind, you're supposed to be worrying about something, but I couldn't remember what it was. So are these things that someone goes through normally? What are the common feelings when someone starts taking medication?
Yeah. As you rightly said, many of the people do feel this. You know what happens when you're going through depression? Obviously, you don't come to know just immediately in first week or so, unless until you have experienced that into the past, right? So over a period of time, you're getting so used to that worrying, going through that, the negativity of the thought process, feeling so very sad. So moment when you start taking medications and you start feeling better, okay, so obviously first it affects on how you feel, the mood wise, and also about your thoughts. Okay, so person start feeling that it's kind of numbing my, I'm not able to think about it.
Yeah.
That negativity which goes down. But it is actually not affecting on your thinking process. Okay. So thinking process remains the same. It is only what negativity which one experiences that starts going down. The mood starts elevating. So it is not going to affect on the thinking process. Like, okay, if some problem is given to you and which you are able to solve earlier, Once you start taking medication, your problem solving is not going to go anywhere. Okay.
Okay.
It doesn't affect on thinking process.
Okay. And so talking about different another issue like anxiety or personality disorder, what do the medications do in each of these cases?
Right. See, I would say that in any kind of illnesses, one basic, what you say, the function or basic principle which applies. Okay, what happens in our brain? There are nerves which are called neurons. There are different cells which are there, like we have muscle cells, bone cells, heart cells. So the brain cells are known as neurons. Now, neurons has connectivity, and it is called axon and dendrites. Okay, I'm not going too much into technicality of it, but when these two neurons are attached, there is a kind of a gap in between. They're not exactly kind of stuck to each other. There is a small gap in between, which is called synapse. Okay, so now whatever signals which we get generally, they get transferred from one neuron to other neuron through the chemicals. Those chemicals, what we call as a neurotransmitter. So there are different kinds of neurotransmitter, as I already mentioned about serotonin, dopamine, and different transmitter has a different kind of presentation. And depending on that, we have the diagnosis. Okay. So what medication does is they help in between this balance between this chemical in that gap, in that synapse. There has to be a particular amount should be available to have that normal function, which gets affected in the illness process. So this medication just help in that. They may work on the previous neuron, they may work on other neurons, they may work on the chemical itself. Those are all technical things, but this is the basic principle in any kind of a medical, I mean, mental illnesses. The medication is so whether it's anxiety, whether it's a schizophrenia, whether it's a depression, whatever it is.
So in your so this sounds like something like for a lay person to hear about it sounds very complicated. But I'm
Right.
sure that with your experience, you're able to judge which medication is required to fix that imbalance. So, can you walk us through that process of meeting a patient? How do you evaluate whether they need medication and for how long?
Right. Yeah. Okay. So whenever patient walks in, generally, okay, the problem either it's into the mood, patient is not feeling good, or there's a problem into the thinking process, or problem in the behavior. Generally, in broad sense, these are the three things which are the functions of mind, and if they get affected, person seeks the help. Okay.
Yeah.
Now, whether person is going to need the medication or not going to need the medication depend because on the one thing, the cause of it. So in cause, what happens is either one is the psychological issues, any kind of a problem in your life, person losing job, or there is a relationship problem, or financial loss. All these are the stressors which also affects on person's mind. That's one thing which is called the psychological problem. But there is another is a biological factor where what I mentioned about these neurotransmitters. So that imbalance is there. Because of that, person has the symptoms of whatever illness, depending on the neurotransmitter. So in such cases, sometimes there are stressors also associated with something which has happened in the life that is also there. But sometimes there is nothing external. Many a time patient comes and says, actually in my life there's no problem. Everything is fine. My family is fine. I don't have issue. I have good career. Everything is going well, but still I feel very low. No, I'm not able to cope with my work. So that's exactly is the what because of that endogenous depression, because it's a biological cause. Okay. One very characteristic features to differentiate between two is the sleep pattern.
Okay.
So first thing what gets affected is the sleep. Mostly all psychiatric illnesses generally sleep is affected. The patient is not having a good sound sleep. Either person feels difficulty in falling asleep, has to lie down in bed for hours together, or sometimes if someone gets the sleep, they get up in between and then it's difficult to fall back in. Or sometimes there is something what we call as the early insomnia. This patient sleeps well, but in the morning they gets up before their regular time. Like if person is used to get up at 7 or something, person will start getting up at 4 or 5 and after that not able to sleep. Okay? So that is early insomnia. So basically this is what is the main characteristic feature. Apart from that, then we have our own system of diagnosis, which are called DSM-4, DSM-5. There are ICD-10. So all those technical things which are there, okay, based on that, and that's what our training, which is all about. After MBBS, what time we spend in learning that. So we do that depending on those criteria. We decide whether person, what kind of illness person is going through. That's why in our case, mainly the history taking. It's talking to the patient and talking to the patient's relatives. Because how patient feels, that patient can talk about, but how patient behaves, that the other people are in a better position to tell us, right? So it's a history taking is very important in our case. Then there is something called as mental status examination, which we do talking to the patient, giving certain very small exercises to the patient. That is what is mainly the diagnosis depends on that. We don't have any kind of a blood test, but there are some psychological testing which are there. So in case when we feel okay, diagnosis is not so sure, then we refer them to get the psychological testing done to confirm the diagnosis. So this is the whole process on which we decide, like, okay, whether person is having any anxiety issue, whether person is having depression, or person is having schizophrenia, or is it a personality disorder, whatever it is, and then depending on that, we prescribe the medication.
Yeah. I remember thinking that when I was diagnosed with these antidepressants, I remember thinking, but how do you know? How do you know that my serotonin levels is less than
Right.
other people?
Yeah,
But
yeah,
yeah,
right.
I guess
That's
all
why,
that,
yeah,
yeah,
sorry.
all that training is involved before you reach a point where you can make that judgment call. It's not just a common man saying, hey, your serotonin is low.
Yeah, yeah. See, that is why I always tell people that do not hesitate to take the professional help, because many times what happens, it's taken as no, 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 it's nothing, it's only in your mind, don't worry, you just be
Yeah.
brave, just do more exercise, eat this food, eat that, and you'll be fine. Just in mind, you just have to cheer up, you just have to push yourself. When person is going through depression and someone asking person to just push yourself and do little harm, it's something like I always give this example, that person is having a fracture, okay,
Hmm.
and you tell the person, no, 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 don't worry, you do just little this exercise and you'll be able to walk, or you'll be having, right?
Yeah.
Actually it's going to worsen that fracture, right? So exactly like here, first you need to understand that it's a depression, I mean biological endogenous depression, it needs a treatment, or any kind of psychiatric illness, it needs a treatment. Once you start taking medication, you feel better, definitely you can have the counseling or psychotherapy, that will definitely help, and both go hand in hand, okay. But this is very important to have this diagnosis, and diagnosis is just not just out of our just imagination or something, like, okay, today I feel I want to diagnose depression, okay, so I'll put all of them into that category. It's not like that. All that training help us to understand what is happening.
Because especially in India, people are always looking for alternative treatment. So when it comes to something like mental health, they tell you like, no, 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 don't take these chemicals. Instead, try doing some yoga, try doing some, you know, go to some alternative medication. And if you do opt for going to a psychiatrist and getting that professional help, people think that, you're not trying hard enough, you know you're just giving in. That kind of notion is there.
Right.
So let's bust those myths. Let's get dive right into all these misconceptions and talk about them.
Yeah.
So first of all, people think, as I said, you're not trying hard enough, right? So the misconception is that if you're taking medication, that means you're mentally weak. You're not trying hard enough.
Right.
So, what is your response to this thought process?
Yeah, yeah. See, very commonly this conception which is there, mentally weak. Now, when you say mentally weak, what does exactly that mean? So, mentally weak generally is into the intelligence wise, what we talk about. Generally, that if
Yeah.
you're mentally weak means you are not so very intelligent, right?
Mhm.
The person is diagnosed with any kind of psychiatric illness. Till that time, was person having any intelligence problem? No, right? And
Yeah.
after person gets treated, after that also person is doing really well. So where's the question of having this mental weak? This is
Mhm.
something like talking about, if you are having a typhoid,
Mm.
you are physically weak. I mean, does that depend on how is your health physically? I mean, whether you are very muscular, strong, or whether you are weak, or you're obese, or you're thin, it doesn't depend on that. If you get
Mhm.
infected, whether it's a TB or typhoid or something, you get infected. That's a illness. So these
Mhm.
all are illness of mind. As you have illnesses of body, these are illnesses of your mind. So it's nothing to do with your weakness or strength or anything. Nothing to do with the functionality of you know
Yeah.
mind. Yeah. So it's absolutely a myth that you are mentally weak.
Okay. And for a lot of medications have side effects. So people wonder, can these medication affect your memory or your thinking process, as you said before? Can they make you dull or forget things? Is it possible?
Yeah. Yeah. Again, this is very common misconception which is there. So, see, the medications are not going to affect on your memory. As again, I'm saying that's also one function of it. And these medicines have specific function of correcting that imbalance. Okay. While doing that, obviously, it's not like, okay, the brain is such a complex and there are so many things in such a tiny structure which is there, right? So obviously, it may have effect on your other system. Like like you have more of a sleep, or sometimes there is in some medication there is a weight gain. Some medication may have little what you say digestive problem like nausea,
Mm.
vomit. But that way, all medications have certain side effects because all medications have uh, chemicals basically. When I say all medications, the medicines which are working for your physical illnesses as well. Like common painkiller also will have the acidity as a side effect, right? Some antibiotic have a digestive problem like loose motions and all that. So side effects may be there. But now, over a period like, last few decades, the research has been going on and scientists have been working and they're coming up with newer and newer medication with fewer side effects.
Mhm.
So it's like, okay, we can work onto it. It's nothing so major as such. Okay, it's a requirement that you have to take the medication. I always say you need to weigh the pros and cons, the
Mhm.
benefit effects against the side effect. What is most required? If benefits are more, you have to go through it. And certain side effects, we also have the other kind of medication. Like for schizophrenia, psychosis, we have antipsychotics. Certain antipsychotics have the side effects of having the abnormal movements, like tremors. Okay,
Mhm.
we have certain medication which we give along with that, so that that side effects doesn't occur.
Okay.
So all the problems, what we think are problems, have the solution, but it can happen only under the guidance, the professional guidance, not to take your decisions on your own. Right?
Yeah.
Because everyone's body system is different. What medicine is suitable to you, the same kind of diagnosis. People are diagnosed with depression. What medication suits you may not be suitable to other person. So
Mhm.
every individual have a different body will have a different way of behaving. Right? So if any issue is there, I would advise everyone, if you are going through any kind of a psychiatric problem and you have been prescribed medication and you find that okay, that medicine is not suiting you, or you are having any kind of side effect, or you find the dosage are high or low, whatever, for everything, please discuss with your psychiatrist. Don't take a decision on your own. Okay. And especially not going on the Googles and finding out the answers, self-medicating or taking decisions about your medicine. Not at all. Right.
Mm, yeah, because I think in India, it is especially easy to get things that need to be prescribed over the counter without those prescriptions. So people often do think that, okay, if I Google it, I can just, find it from my local pharmacist will give it to me without prescription. So it's a good point that you put across.
Yeah,
It
yeah,
is, yeah, it is something that is safe when diagnosed by the right person, when evaluated and monitored properly, right?
exactly, exactly. And as you pointed about over the counter, thanks to now the strict, rules and regulations which have been coming up, now it's very restricted. Chemists
Mm.
won't give you without prescription, and they will give you only for the time which has been written on your prescription. So I'm really happy that this thing has come up.
Yeah.
Especially the problem was with the suicidal patients.
Mhm.
Used to happen that the abuse was there. People used to go and take the medications over the counter from different chemists, and they used to gulp all those tablets for with the
Okay.
suicidal intention. So
Hmm.
now those restrictions are there, so it's really good that people can't get medicine just like that.
Yeah.
But I would like to point out in psychiatric medication, more than going and taking on your own, people are very eager to stop the medications.
That is true,
Right, right.
because I think there's a conception, especially even I felt it, that as long as I'm taking this medication, it means I'm sick. So if I stop the medication, that means I'm fine, I'm cured,
Right, right,
right?
right, right, right.
But there is a proper way and a proper time. So walk us through that. How do you decide that a patient should stop the medication, and how do they go about that?
Yeah. So again, here differs what illness it is there, how long the illness has been there, okay,
Mm-hmm.
and what are other comorbidities. Comorbidities, as in the stressors in the life, okay.
Mm-hmm.
So that's psychosocial background of the patient. How was the person adjusting to his or her life prior to illness? Okay. So all these factors decide that how is going to be the progress of illness. Depending on that, we have to decide about the medication and duration of it. If suppose a person is having the issue the first time and it's very suddenly it has come, there is something called as nervous breakdown, like
Yeah.
yeah, or something like acute psychosis, something which has just come very, what do you say, the abruptly it has just started. Okay, so in such cases medications are given only for limited period of time. Okay. And but if person is having repeatedly these illnesses and it's going on for longer period of time, then we need to continue these medications, maybe 6 months, maybe 1 year, maybe 3 years. So this again depends from person to person. There is nothing like a blanket statement I can make that okay, all the medications have to be taken for so much of a duration, because there's another misconception people have is once you start the medication, you will have to take it lifelong. Okay, not necessarily in all cases. Certain cases, yeah, definitely, where there is the intensity is much higher and it's a chronic, like the illness is going on for years together. There is not a good socio-economic background of the person. Okay, so maybe certain cases, yeah, person has to take lifelong, but otherwise, generally we see how the progress is going. So maybe it's a 6 months, 1 year, 2 year, depending on that we advise them to take. And that's the reason why follow up becomes very necessary. Hmm?
Yeah.
Not to just start taking on your own. So follow up after say 1 month. Initially, follow ups are a little more frequent because we have to also tighten the dosage adjustment. As I said, we don't have any kind of blood test as yet to find out which medication is suitable and in how much. So we have to do trial and error. And as I said, like, two patients having same diagnosis may not be, the same medication may not be working on both of them, right? So that's where we have to do that trial and error basis. So that also takes little time. So initially visits are little frequent, say weekly or after 15 days or something like that. Then follow-up can be after 1 month, 6 months, 3 months, whatever.
Okay.
That is the process.
And what is the process of, say, you see improvement in a patient and you decide, in your professional opinion, that they can start getting off the medication? What is the process of that? Because is it possible to stop it abruptly, or what is the process exactly?
Yeah, yeah. Absolutely no, no, no for stopping medications abruptly. Okay. There's something called as withdrawal symptoms, which is there if you stop the medications abruptly. So never to do that. Okay. Never to stop your medications on your own. Always take the opinion and guidance of your treating doctor. Right. Now, once we come to know that person is doing fine, okay, so when we examine the patient and when we take the history and talk to the person, we see how the person has been behaving. The behavior, the thought process, the emotions again, whether they have come back to the original. When I say original means before the illness was started. Okay. Prior to that, how was the person? Whether he has come back to that level. Okay. If that is so, then we give something called as a maintenance. So again, that depends from 6 months to 1 year. So initially, we are increasing the medication till the time we know, okay, person is doing well. Now he has come back to almost normal. Then there is a maintenance period which is there. And after that, then we start thinking of tapering it off. That person is doing well. There is no another episode which has come in between. Person is well adjusted back to his routine. Then we start thinking of tapering it off. And that is like slowly, gradually, we have to taper it off, not suddenly.
So what happens if, what if a patient suddenly stops taking that medication? You mentioned withdrawal symptoms, so what
Right.
exactly would they experience?
Yeah, yeah. So something like, see, whatever the problem for which the medication has been prescribed. Okay. So suppose like, okay, I'm having anxiety or I'm having a sleep problem along with that.
Yeah.
Okay, I don't feel good. So for that medication has been given. And then you suddenly stop it. So you start feeling much more anxious moment you stop the medication. You don't get sleep properly because that was again another issue. And that is sometime it's little worse than when the illness was started. Okay. So then person really feels very panic and very scared of the whole thing. And that also is taken as like, okay, this medication caused this. No? Because
Yeah.
of medication, I had to go through all this. Actually, it's not because of medication, but because if you stop it, abruptly. So that is the reason why you have to go gradually.
Right. Okay, so we have some questions in the comments. First of all, Havisha has said it's such an interesting topic, and she asks, what are stereotypes attached to using medicine for mental health treatment?
Pardon, can you just repeat it once, Anthea?
What are the stereotypes attached to taking medication for mental health?
Yeah. Okay. Um, right. So, see, generally the stereotypes which are there along with the medications, if you mean to say, whether it is when you start taking it continuously, whether you develop that kind of a behavior, what I understand from her question. Yeah. So certain medications, those are also antipsychotics, which are there, which if it's taken for long period then that can happen. Certain behavioral issues like involuntary movements or something. That kind of stereotype can come into the person. Okay. So that is one. But otherwise, generally, many a times what we see when medication people are taking, what they do is they take it for some time, then they start feeling little better. On their own only they discontinue it. And then when the next time they have another episode, then they will come back. What happens is The second time, then they need much more medication, the higher dosage and everything to control that. Okay. So this repeated kind of a behavior which needs to be avoided and not to go through that. That's why I said that, always go by advice of your doctor.
What about from the public point of view? Like, for example, if a person seems, what I've noticed is from a friend is that they experienced this where they saw someone who was experiencing symptoms of schizophrenia,
Mhm.
but this person's mother kept saying, no, but he's very intelligent. He handles all the accounts. He knows how to do so many things. So he can't have any disorder.
Right.
So is that also another, misconception that people have that, oh, if you are able to do other things, that means that you can't have any mental disorder.
Right. Yeah. So I'm thankful that you got this again. A very interesting question. Yeah. This is again misconception that illness process. If someone is having the mental illness, means memory and intelligence also affected. It's not. As I said, the intelligence is affected generally when the child has mental retardation. That's one condition. And memory is affected generally in the dementia, if any person is having. But apart from that, it's not. Sometimes the forgetfulness, which is there as a symptom of depression, but that's temporary. Okay. So it doesn't have any connection. So if person is even is doing a intelligent work or his memory is perfectly fine. I also get commonly people they talk. He remembers everything from the past. He remembers, like we forget where we have kept the things, but he remembers very well. How can it be? So it doesn't have any connection with memory or intelligence. Illnesses can be separate. And as you said, okay, the people who come to know and mother is in denial, that's common thing. And that's why I'm really happy that this platform, this kind of a work is required to create that awareness, spread that awareness, something called as psychoeducation, which has to be done and which has to be told to the people. There is nothing wrong, in taking help, because rather timely help will save your life. Save your life as in not going through that dragging period of it, just pulling it on. You can have very normal, healthy life. So it's very important to take the timely help, not to worry about it. You can go back to your normal self. If you take treatment in time.
Another common thing that I've noticed is that, especially with things like anxiety or depression, is that people say, oh, but today she was very happy, today she was very cheerful, today she seemed fine, so she can't possibly have that. So, is it possible to for these symptoms to come on and off like that?
Yeah. Okay. So again, this one common, the what you said, the confusion people have. I would like to clarify that sadness and depression are not one and the same. Okay. One can have sadness, as I said, any kind of issue which happens in our life, we tend to feel sad. Okay. That's not exactly same as depression. Though depression word is used sometimes commonly. Today I'm feeling so depressed, I'm feeling so bored. So it's commonly used. So when we have to call depression, as I said, we have that procedure. So since you brought up the topic, I'll say all those symptoms which are there is a checklist kind of a thing. The symptoms for every illness, there are different symptoms which are there. Those symptoms should be there in any individual for at least say 2 weeks period continuously. Okay. So then we give that diagnosis. So it's not like one day only you're feeling little low in mood, so we start feeling that okay, you are depressed. No, it's not like that. But when person is having depression, it doesn't mean that they can never feel happy. Even during the course of depression also, sometimes some moments they can feel happy if something really kind of genuinely, but overall their mood is generally low. Overall they generally feel very sad. But yeah, they can feel momentarily, but if it is depression is going on, in that it can feel. But it's not on and off. As I said, one day if you are having depression and suddenly, I mean, one day you are feeling sad and the second day or third day you're fine, that doesn't mean depression. It has to be continuously there. Any kind of, like even for schizophrenia, if that behavior is going on for some period of time, okay,
Yeah.
then that diagnosis is given to the person.
Okay. Some more questions from the comments. Seema asks, does diet also have an impact on mental health? So,
Good question. As I said, see, diet per se is not directly related to mental illness. Okay. What I told you in the beginning, the mental disturbance, disorder, and disease. Okay.
yes.
Disturbance may be sometime, you know,
Mhm.
because if you're not having healthy diet, if you are not feeling, overall your health is not so good. So sometimes you tend to feel little irritable. Okay. So that can be there. But the mental illnesses per se don't have any connection. It's not that you eat particular kind of food and you get this illness, or you eat something and your illness gets treated. It's not like that. Okay, that is only because of chemical imbalance which is there and which is genetically predisposed, which is there. So no direct connection. Yeah, but certain points I would like to put it here is, generally it is seen that the person going through depression, okay, they have more craving for the sweets or especially for the chocolates. Okay, so if some person starts having that craving which is not normal of that person, okay, which is more than that craving is there. So maybe person is not realizing that he or she is going through depression. So this can be one factor which can make them look into themselves. So is it, I'm going through depression, so that craving is something like that happens even in mania. We have seen the tobacco consumption in the mania. So that is there. Here I would like to mention not the direct connection of diet, but about the eating disorders. Okay, that can happen. Like sometime people, something called as anorexia nervosa and bulimia nervosa. These are two common things. Where
Yeah.
person does not feel like eating. That is anorexia basically. Absolutely, whatever even the required amount person doesn't eat, and person start losing weight, very pathologically losing weight actually. So that is related to the food part of it. And in bulimia, it's like person keeps eating. It's binge eating which is there, and then they vomit it out also.
Mhm.
So that is, those disorders are related with the eating pattern of it, but per se any kind of a food material or diet or anything is not related to
Okay.
causing the illness process. Feel good factor can be there when you eat certain kind of foods,
Yeah.
foods definitely. Yeah.
Yeah. So, is it possible that, some people who are really apprehensive about medication, they start to look for home remedies, things that can improve your mood through, the diet that you have? Are those things possible? Can it help?
No, no. Again, I will say, if it is a properly diagnosed illness, only any kind of diet change or any kind of a diet regime is not going to help. So generally, what I advise to my patients, if they come up with such ideas, I tell them, you're free to try all that, okay, along with the medication. No? So you can try, because there's nothing like restriction that you cannot do this. Start taking medication. Along with that, you try. Over a period, when you start feeling better, we'll slowly taper off your medications. Okay? But not only on the diet basis. No.
Um, all right. So we have some more questions. Like the diet question, there's also a question: does exercise also impact your mental health?
Okay. Yeah. So exercise will help you in having again those mental disturbances. Okay. When you're having any irritability or anything. So what happens exactly with the exercises, as they call, there are certain chemicals called endorphins which are released in brain. Okay, those are feel good hormone. Yeah, so that makes you feel good, and that's why whenever we exercise, we feel little more energetic. We feel happy, and we are able to focus more. Okay, so yeah, exercise can help you in that way. But again, the mental illnesses like a schizophrenia, like a bipolar disorder, like endogenous depression, exercise is not going to help you. Okay. Many a times person is going through depression won't have that motivation, energy, even if person knows that okay, I need to do it, but does not feel like doing it. Okay. And if you push that person, again, it's like going to backfire. Yeah.
Yeah.
So,
I remember before I got professional help, I started feeling low, and I thought, okay, if I eat right, if I do exercise, if I, find some hobbies, listen to these positive talks and things on YouTube, that will help me. And then when it didn't work, I thought, oh my God, something is wrong with me. I'm never going to get better. So I think that it's very good to clear up these misconceptions, because a lot of people will say, oh, medication, you don't need medication.
right.
Just do exercise, do these things. They
Exactly.
don't realize that people are actually trying
Yeah.
and they're still not feeling better.
Right, right. You have got this point very rightly. I have so many patients, but I remember one lady particularly, and this had made her life much more miserable. No, what happens is, as I said, it's not that intelligence or your thinking capacity has gone somewhere. It's not like that. So you know what is right, what is wrong, how should be your healthy lifestyle and everything. But she was going through major depression and she was unable to do all these things. So as it is, she was feeling bad. And when people were trying and kind of forcing and giving her advice and everything, she was feeling much more bad and much more worse. That something really drastically bad, and having that guilt feeling that I'm good for nothing, I'm not able to do anything like this. So it as I said, it can sometimes backfire. So it's not actually required to be done that way. First foremost, have that diagnosis, have that clarification. As I said, see, if it's just at the level of mental disturbance, okay, the psychological factor, your stressors in life which you're not able to deal with it. So in that, yeah, your diet, your exercise, having any kind of a hobby, talking to people, having that social support, everything helps. That doesn't mean if you're taking medication, all these things you need to ignore. Okay, no. You can have that. Obviously, that healthy lifestyle is always recommended, but that's not a substitute for your medications. Yeah.
Yes. Okay, a very important question. Rajika asks, how immediate is the effect of these meds?
Yeah, very good question. Yeah. See, what happens is, as I said, there is a level of those neurotransmitter which is in imbalance. So, for that balance to come back, there has to be an optimum blood level of these medications,
Yeah.
which is generally somewhere from, say, 1 week to 2 weeks, period, depending on those medications. That's optimum level by which you start thinking, okay, this level has reached, medications have reached to that level, and you'll start seeing the effects of it. Okay. Having said that, there are certain uh, symptoms will start improving immediately also. As I said, if there is a sleep issue, person will start having good sleep once you start the medication. Okay, general anxiety factor, that will also start going little low down, even immediately also in say 1 or 2 days time. But to see that effect, generally that is week to 2 weeks period which is there. That's why when we call for follow up, we give that much window. So by then we know, okay, the medication, how much effect is there, whether we need to increase the medicines, dosage of medicine, or whether we need to add some other medicines or whatever. So that is the period.
Yeah. I think it's very important for clients to know that, because sometimes, like even for me, when I started taking medication, instantly I didn't feel better. And then I thought, oh my gosh, nothing can help me. I felt so hopeless. So it's very important
Yeah,
for people to know.
having that patience is very important.
Yeah. So, um, like you said, there are certain that it doesn't necessarily mean it's lifelong, that all these medications need to be taken for every issue. But are there certain disorders require that medication for the rest of their lives?
Yeah. See, again, here, generally, I would say psychotic illnesses, basically, the schizophrenia, bipolar, they may need it. Okay.
Mhm.
But again, having said that, it's not categorically that every schizophrenic patient will have to take it. It
Okay.
depends again how many episodes patient had previous to that, whether it has been happening for long time of, like many years person is suffering through it, the intensity is very much more. In such cases it may be, required to have it. Okay. So, broadly, just if I had to say, there is nothing specific which I can remember now, but broadly, it's like, we can say 33%. So 33% of patients will have to take it only once and they are
Mhm.
fine with it. 33% of patients will have repeated episode, but they take the medication, they feel better, they stop the medication. When the episode is there, then they take it. The remaining 33% maybe will have to take it for a longer period is or sometime even for the lifelong also. So that's like broadly speaking, but again I would put it that it's not a blanket, that complete universal, it's not universal law, depends from person to person how it goes. And another point here I would like to mention is, see, that's the reason that psychoeducation part, what we all psychiatrists generally practice, giving information to the patient and also to the relative. Mm.
Yeah.
Educating them about the illness and how to identify, because many times what happens, you have illness, you're treated with the medication, you feel better, we taper it off, you're perfectly fine, but next time if it's happening, okay, you should be aware the moment those symptoms it start take the help immediately in the beginning stage so that it can be controlled easily and with the lesser dosage also. So we educate family members and also to the patient that what symptoms they should start looking for it and when should they seek the help.
Mm. That, I think that's a very important thing to note, because a lot of people think that, okay, once I've gotten through this, I'm cured. It's never going to come back again.
Right.
And then even if it does come back, they feel like, okay, there's something wrong with me. It's not
Exactly.
supposed to come back.
Yeah.
Nothing will ever help me. But
Right.
we should start understanding that it's okay to take these medications. It's okay to require that help.
Yeah. Perfect. Right.
Yeah. So, another thing I wanted to ask you about the process of coming out of medication. Is it possible that in between, like, suddenly, if even if you're weaning off the dosage by very minute increments, is it possible for the patient to start feeling so-called bad again or feeling those symptoms again? And how do you deal with that? Do you continue going off the medication, or should they go back to the medication?
Yeah. Yeah. uh, it can happen, right? Because as I said again that we don't have any kind of a blood test, so we don't know, but the person is feeling fine with that dosage, we feel now it's okay. Sufficient time has gone when he's been doing well and we can win it off, and when we start winning off and we find that person is having those symptoms again back, either we stop at that dose. Okay. So just to take an example, suppose someone is taking some medication of 50 milligram and I start weaning it off. So from 50, I bring it to say 25. So that's fine. Then if I bring it to 10, because no patient is having symptoms again, so we need to go back to 25. So because with the 25 milligram, person was doing fine, patient was doing fine. So go back to 25. If not, even that is also not working. Once you increase 25, then again go back to 50. It's required. And if the patient is fine with 25, leave the patient at that for another, say, maybe a 6 months or a year period or something, and then reevaluate again. So it's quite possible that it can happen. And that's what I told you about that maintenance dose.
Hmm.
Initially, to control the symptoms, we may have to give higher dosage. Okay. But when we start weaning off for longer period, we give the lesser dosage, what is called as a maintenance dose.
Okay. So I think that even I am coming to, along with our viewers, I'm coming to understand a lot more about this medication. And I think it has made me also more compassionate towards, not only towards myself, but towards other people taking medication and the whole idea, because I think that everybody has this notion that, okay, you need medication means something is wrong. So we need to understand that it's okay, first of all, to be taking these medications. That doesn't mean that you're a horrible person. You've not done anything wrong. You've not done something to deserve this. It's
Right.
just a part of the
Yeah.
process of getting better. And it's a helping hand that we all need sometimes. I mean, not all of us, but that some of us may need sometimes.
Exactly. Exactly. It's like as you have body, you have a mind. If body can fall sick, your mind can also fall sick, right? And if you're having some physical illness, doesn't mean you have gone and done some kind of a crime. That's why physically you're falling sick. Same with the mind. If you're falling sick, your mind is not doing well, does not mean that you have done something wrong in life or you are not a good person. Hmm? The
Yeah.
person per se is not equal to having an illness. Okay, the person is not bad or person is not right or wrong, person is just ill and needs treatment. That is very important to be understood and followed, right?
I think this has been a very, very interesting conversation for me, and I'm sure that all of our viewers have enjoyed it. So before we wrap up, I just want to ask you, Dr. Jyoti, is there any message you would like to leave our viewers with?
Yeah. Uh, First of all, thank you very much to you, Anthea, and to MHT for giving this opportunity and sharing my experience. And as I said, this topic is very near to my heart also because I always feel that when there is solution available, why suffer so much just because having certain wrong notions about it? So anytime, if anyone, you yourself or your family members, because many a times I have seen that even if patient feels that okay, it's required, it's family members who say, that you don't need it, how long you're going to take, or sometime in that fit of anger or irritation during the arguments, they say that you are not good enough, your opinion doesn't count because you're on the pills and you're taking medication, so you are a gone case kind of a thing, what they use the word. So please don't do that. Be very supportive. Any near and dear one is having an issue, and be alert and be aware. If someone is having an issue, guide them, help them out. And there's no harm in taking medication. Rather, I would say harm in not taking medication. Okay, it's always very important to have timely help. The treatment, if it's started very early, we can control illnesses very easily. And as always say, that one statement what people generally make: oh, I don't need to go to psychiatrist, I am not a mad person. So I always tell them, if you go to psychiatrist, you won't become a mad person. So
Yeah,
that's very, yeah,
that's true.
important to have.
Thank you so much, Dr. Jyoti. And thank you to all our viewers as well. If you want to find out more about Dr. Jyoti, she's featured in our directory, which you can visit on our website, mentalhealthtoday.co.in. And for all our viewers, today we have a special coupon code, MHT medication. So please do go to our store and check out the products we have. Thank you, everybody. Thank you, Dr. Jyoti.
Thank you, Anthea.
Okay. For all our viewers, please like, share, and subscribe. Thank you.
Thank you.